Ladies, if you're struggling, I'm going to give you natural solutions to reverse PCOS. Hello and welcome to Total Health with Dr. Nick. My purpose is always to inspire, empower, and motivate you to live longer, healthier, and more abundant lives. And today's video is a great one because we're going to talk all about PCOS, what causes it, what are natural remedies for it, how you can reverse it, and how you can get your life back. So make sure you pay close attention. Watch to the end because I'm going to give you a lot of solutions for this. And guys, if you like what we're talking about, make sure you like, share, comment, and subscribe. Make sure you click that little bell notification so you get notified anytime I do a video. So let's go ahead and jump in with PCOS. So what exactly is PCOS? And if you ladies have been struggling with it, you know exactly what it's about. I have 4 daughters myself, so I want to make sure if any of them had it, which fortunately they don't, I want to make sure I can take care of it naturally and give them natural solutions also. So what exactly is PCOS? Well, PCOS, of course, is a hormonal problem. It's going to be affecting your hormones, and ladies, very different than guys. You have a lot more hormonal complications than we have. It's a lot more complex system than guys have. But basically, it's an abnormal hormonal condition that's affecting ladies basically in their childbearing years, anywhere from 15 to 44. So this affects a large span of ladies. As much as 70% of women have PCOS and aren't even aware of it. It's a syndrome, a group of symptoms that basically combine to form this thing we call PCOS. The 3 main features are cysts in the ovaries. Now, these are immature cysts. These are immature eggs, not mature enough to really trigger ovulation. So that becomes a problem with your cycle. Your cycle becomes very, very irregular, or sometimes you can even miss cycles. Sometimes you maybe just don't have as many. You might have 8 a year, you might have 6 a year, or none at all. And also too, high levels of male hormones, okay? So those are the 3 things that really culminate together to form this diagnosis that we call PCOS. So what are the symptoms of PCOS? And like I said, if you're experiencing it yourself, you are very well aware of what these symptoms are. But maybe if you're not aware of them, maybe this is something that you're thinking you might have. This is going to give you some clues as to whether you should get diagnosed or not. Irregular periods, fewer than 8 a year, and sometimes maybe even none. We see this a lot with clients that start with us. They might come in and they'll have a period maybe every other month or every 2 or 3 months, maybe 3 or 4 a year. And you know what the problem is? You start to think, well, maybe that's my normal. I had a young girl come into me many years ago. She actually worked at my front staff, and she was having issues where she would have a period maybe every so often. And I said, once you get under care in the office, because as being an employee, you're going to be able to receive care here too, you're going to start to see them more regularly. Well, I'll never forget the first time she got it the very next month, and she called me up and she said, Dr. Nick, I can't come in today. I need to go to my OBGYN. And I said, why? What's going on? She said, well, I got my period this month. And I said, well, but that's good. You're supposed to. Well, no. She said I need to come in and get checked out. I said, well, please be very careful. Do not go in and have her put you on medication. She wants to check you out, fine. But don't go in and have medications simply because this is abnormal to you. This is what is supposed to happen. And sure enough, she came back. She said, fortunately, she didn't want to give me anything for it, but she really can't explain as to why this is happening. I said, well, you're starting to take care of yourself better. We're starting to do things that build health in your body rather than sickness and disease. So you will start to experience, as it reverses, periods on a regular basis, 12 a year. Abnormal hair growth. Well, more than 70% of these women with this condition will have hair growing in places they wouldn't normally expect. It could be facial hair. It could be maybe on their neck. It could be on their chest. It could be on their abdomen. Hair is going to start to grow in places that you wouldn't normally expect because of the abnormal high amounts of male hormones. Maybe acne. Male hormones are to blame for this one too. Guys, we're just always to blame for this. They make the skin oiler, and it can make it where acne shows up once again on your face, on your neck, on your chest, on your abdomen, on your upper back, okay? Weight gain, up to 80% of the women with PCOS will put on weight. So one of the remedies is going to be to start to lose the weight. Just by starting to lose weight, you can actually really help this condition. Male pattern baldness. So many of you experience that. Once again, you have so much male hormones, androgens, testosterone, that you actually start to get male pattern baldness as a result. darkening of the skin. Dark patches of the skin can form on body creases like the neck, the groin, and even under the breast tissue. So you'll start to see different colorations happening because of the different hormones. And of course, headaches. Hormonal changes can, of course, trigger headaches. You know that. You see that. Maybe you get headaches around a certain time of the month when you're experiencing your period, and all of a sudden headaches start to kick in. It has a lot to do with hormonal changes, and that's, once again, something that we also take care of a lot in our office, and we get really, really great results with it. So how does PCOS affect your body? Well, unfortunately, it can affect your body in many, many different ways, and some very seriously. Some can even cause things like metabolic syndrome. But infertility, a lot of you experience that when you start to go through these irregular, abnormal periods where the follicles, or I should say the eggs, are not mature enough. You're going to have issues with trying to get pregnant, or infertility issues. You can have, like I said, metabolic syndrome. Up to 80% of the women with PCOS are overweight or are obese, which increases the risk of high blood sugar, high blood pressure, low HDL, or the good cholesterol, and high LDL, what we refer to as the bad cholesterol. Now, I will tell you guys, many of you who've watched my videos, I don't believe there's a good or bad cholesterol. Now, first of all, HDL and LDL, and I don't want to get into this too deeply because I've done videos on this. You can go back and check them out. But HDL means high density lipoprotein. That is not a cholesterol. That is a boat that carries cholesterol, just like LDL is a low density lipoprotein. These are lipoproteins. They're not cholesterol. They're boats. They're just carrying the cholesterol around in the bloodstream because cholesterol is not water soluble. It's very fat soluble because it's a fat. It doesn't do too well in water, so you need HDL and LDL to carry it around. Well, there's a very important function for LDL, and that is hormone production. So you don't want to necessarily lower your LDL too much unless it's a bad type of LDL, which, once again, I won't get into detail here. Check out some of the other videos I did on that where I talk about cholesterol and what it's really about, what's the real truth about it. But together, these factors increase the risk of heart disease, diabetes, and even stroke. So once again, metabolic syndrome. Diabetes is a big, big factor with that. And if you can reverse diabetes, you can do a lot. You can go very far with reversing PCOS also. Sleep apnea. The risk for sleep apnea is 5 to 10 times higher in women who have both obesity and PCOS than those without PCOS. So once again, PCOS complicates a whole lot of other problems that are normally bad enough as they are, but it just makes it much, much worse when you throw PCOS into the mix. Endometrial cancer can even be a result of PCOS. A thickening of the uterine lining can increase endometrial cancer. Why? Because if you're not having regular periods, the lining is starting to get too thick. And that also then leads to maybe a heavy period or heavy flow because that lining is getting so thick that when you do finally have a period, it's just a lot that's being released there. Depression, both hormonal changes, the skin, the facial hair, the hair on your back, the hair on your chest, all these different things play in to our emotions. Of course, ladies, is going to play into your emotions a lot, and this can lead to things like depression and also to just the putting on the weight and all the other issues that go along with it. So it really, really starts to play a lot on your emotions, and it can lead, of course, to depression. So how's it diagnosed? Well, doctors diagnose this a few different ways. One is that they look at the androgen levels. They look at hormones like the male testosterone hormones. They want to see what levels are at. So they'll do a blood panel on that. And that's the way they'll be able to see, do you have abnormally high levels of these androgen hormones? What about irregular menstrual cycles? And we talked about that. Because the fact that the cells, the eggs are not mature, they really don't trigger your period each month. And as a result, you get abnormal period cycles. You might have heavier times than others because of the abnormal thickening of the uterine wall, the uterine lining. So there's a lot of different factors going into creating these abnormal menstrual cycles. And of course, finally, cysts in the ovaries, polycystic ovarian syndrome, PCOS. That's what it stands for, of course. So when you have many cysts in your ovaries, that is measured using ultrasound. So there's a lot of different techniques where they can diagnose this. But you really want to make sure that all these factors are in play, and you really only need 2 of these 3 to really receive the diagnosis of PCOS. So what then are the causes of it? Well, you can look at it and say, well, genes are the factor, because we do see it run in families. Okay, that does happen. But is it really a genetic issue, or is it more the fact that you have the same lifestyle as your mom does, or the same lifestyle as your grandmother? You do the same things, you act the same way, you eat the same foods, you move the same way. We see that all the time. You start to look at family members and you're just seeing it go through generations because they have the same exact lifestyle. So I don't like to blame genetics for everything, because here's the problem, guys, or ladies, is that every time you blame genetics, you take the responsibility away from yourself. And I'm not trying to blame you for it, but if you don't take responsibility for it, you also then don't have the power to fix it. If you don't have the power to fix it, you're never going to be able to reverse these things in your life. So first take responsibility and say, okay, I need to make these changes. Okay, I know God heals me, but at the same time, I've got to work with God here. For all my Christian friends and believers out there, it's important. Of course, we know God heals and God heals the body, but we also have to take care of ourselves. We can't be saying, okay, God's going to heal me, but I'm going to sit over here and eat ring dings, or I'm going to eat Twinkies and things like that, or I'm just going to have the worst diet and expect God to heal me. God can do so much, but we also have to take our part and our responsibility and our share of the work here. So you can't blame your genes, you can't blame your mama, you can't blame your grandma, you can't blame anybody. We have to take responsibility ourselves. I'm sorry to give you a little bit of tough love, but that's the way I work. I want to make sure you get healthy and well, and I've got to speak right from my heart so I know what's the truth here. And I'm not going to candy coat it, but you can't blame genes for all this. You have to take responsibility. Anyway, insulin resistance, that's a huge part of it. That's why diabetes plays such a big role in this. The more insulin resistance you have, the more you're going to be at risk for PCOS. Up to 70% of the women have insulin resistance. So when the cells can't use insulin properly, the body's demand for insulin increases. Extra insulin triggers the ovaries to produce more male hormones. So insulin is a growth hormone, okay? It creates growth in the body. So you want to keep your insulin levels down. So when we get into the solutions for how we can reverse or cure PCOS, we want to make sure we're doing everything we can to keep our insulin levels down. That is such a huge factor in this. And insulin resistance, which we're going to get into, is a major factor here. So what can cause insulin resistance? Well, bad diets, bad fats, bad sugars, processed refined foods, okay? Bad oils, all these different things can cause insulin resistance, as well as anything that causes weight gain is a factor when it comes to insulin resistance. If you have belly fat, you're insulin resistant. The clients I work with for our virtual practice, where it's almost all diabetic clients, it's always about insulin resistance. Doctors forget about this. They just want you shot up with more insulin or more metformin or all other drugs that just beat your pancreas up. But it really isn't about that. It's about getting the insulin resistance down. And I talk about this all the time. You could have gallons of insulin flowing around in your body, but your body still might not hear it. And as a result, you end up with insulin resistance. So you have to reverse that also. Obesity, major cause of insulin resistance is obesity, of course. Both obesity and insulin resistance can also, of course, increase your risk of type 2 diabetes. That's why type 2 diabetes is such a big factor when it comes to PCOS. When you reverse the diabetes, you start to reverse the PCOS. Inflammation. I can't talk enough about inflammation. Inflammation has always been, and in many of my videos I talk about this, always been one of the biggest driving forces when it comes to creating sickness and disease in the body. If you don't reduce inflammation, you will never get well. You have to reduce everything that causes inflammation. So with PCOS, women often have increased levels of inflammation in their body. Being overweight can also contribute to inflammation. Studies have linked excess inflammation to higher androgen levels. Once again, it takes you right back to those male hormones. Male hormones are getting you again. We're just trouble all the time, aren't we? No. But anyway, if you reduce these right here, the obesity, the inflammation, insulin resistance, don't blame your genes. You're going to have such a leg up on reversing PCOS and getting your life back. So what is the treatment? Well, the treatment really comes down to only a few things. One, you've got to lose the weight. Okay, now I know there's probably some ladies out there that have PCOS that aren't overweight, but the majority, you're overweight, okay? You've got to lose the weight. You've got to bring that weight down. So do everything you can. You only get one shot at your health, all right? You don't get a dress rehearsal here. You've got to get it right the first time. So you've got to get your weight down. Sometimes just losing 5 to 10% of your body weight will make a profound difference in reversing PCOS, or at least alleviating the symptoms of it. Diet. So here's how that works. Any diet that really helps to, of course, lose weight, which is a lot of diets, but there's certain key diets that work even better, because if they can reduce your body's dependency on insulin and reduce your body's insulin resistance, those are going to be the best ones to choose. So once again, any diet's going to work, but you have to use ones that are more superior when it comes to lowering insulin resistance and lowering your body's need for insulin. Of course, 2 diets come to mind, actually 3. But one is, of course, a diet we recommend that we utilize in our office, and that's the metabolic healing diet. A lot of people ask me, what is that? Is that just the keto diet? It's really more than the keto diet. It's really the keto diet on steroids, because we do a couple of other factors in our office. You can use the ketogenic diet, where it's low carb, moderate protein, high fat. Of course, that reduces your need for insulin, because your body's now burning fat for fuel rather than sugar, so that's always a great way to go. But we take it steps above that. We combine it with your genetics, and we also combine it with food allergy testing to know which foods are more superior for you. If foods that normally you would think are supposed to be good for you instead cause your body inflammation, like broccoli, or what about Brussels sprouts? So if you have a sulfur allergy, like one of my patients, Tracy, and she came in and she was complaining about pins and needles and tingling around her mouth, I said, what are you allergic to? She goes, nothing. I'm not allergic to anything. I said, no, you're allergic to something. She goes, well, no penicillin, but that's really it. Well, the penicillin told me she was allergic to sulfur. And when she's allergic to sulfur, she's allergic to eggs. She's allergic to broccoli, Brussels sprouts, cauliflower, anything like that. All those cruciferous vegetables, which are really good for you, weren't good for her. So as a result, it was causing inflammation. Okay? So anything that causes inflammation, as far as foods, can lead to higher levels of PCOS. So like I said, we take the ketogenic diet and really kick it up to higher levels. Or just do the ketogenic diet. Also a great way to go. We've done videos on that, so check out our previous videos on it. But also too, what about the carnivore diet? Carnivore diet works well. I've done it, but you have to do it right. Okay, I've also done a video on that. You may want to check out how to do the carnivore diet right. But it's really a tricky diet. You've got to eat nose to tail. Most people just are eating ribeyes. Okay, that's it. Nose to tail, or rooter to tooter. Okay, that's about eating everything with cartilage, maybe having the organ meats, the marrow, tendons, ligaments, and the meat. Okay, so you're eating everything. You're eating all the parts of the cow, not just the fillet, not just the ribeye, okay, not just the New York strip. You've got to eat it all. So you've got to do it right. But either way, those 3 diets are the ones I would recommend. Of course, I believe the metabolic healing diet, because it does heal your metabolism superiorly. To me, that's always the best one. But exercise. Studies also show that when you exercise, they found it even just 30 minutes a day, so it doesn't take a lot of time. We're not talking about going and working out for an hour, ladies. You could just do 15 minutes of high intensity exercise, 30 minutes of moderate intensity exercise, and at least 3 days a week will help you reduce your PCOS, okay? Not only that, losing weight and exercise also improves ovulation and insulin levels, because exercise helps with insulin sensitivity, makes your body more sensitive to insulin. And when it's more sensitive to insulin, you need less of it, okay? I'm going to throw something else in here when it comes to diet. Fasting, that's another great way to do. If you reduce your body's load on eating all day long, it doesn't mean you necessarily reduce your the amount you eat. You're still going to eat maybe 1,800 calories a day, but maybe having in a smaller eating window. So check out some of the videos I did on fasting, because in fasting, your body's lowering its insulin levels again. So sorry, but it just triggered some memory to go back to that diet. But anyway, exercise is even more beneficial when you combine it with the fasting, you combine it with the proper eating habits. When you do all of that and combine that together, it reduces your inflammation, reduces your insulin resistance, and it starts to bring all those markers down. It starts to regulate hormones better, okay? So when you do all those things, you are really setting yourself up for success. So diet plus exercise helps you lose more weight than either intervention alone, and it lowers your risk for diabetes and heart disease. And that's really what it comes down to, guys. You're always trying to lower your risk for other diseases too. PCOS is a serious one, but metabolic syndrome is even more serious. So guys, I hope you like the video. Also, to stick around, I've got a message at the end, but I really love and appreciate you. Thanks so much for supporting our channel. And once again, I'll see you on the next video, but stick around. I got a quick message for you. Hey guys, I just want to take a moment to speak with you. You know, so many of you are struggling, you're suffering, whether it be with weight loss or weight issues, you're struggling with diabetes or heart disease or any other type of metabolic disorder. Well, you're not alone. Right now, there's over 133 million people who are struggling with diabetes or prediabetes. More than 78% of our population is overweight, and the majority of them are actually obese. Well, guys, there's no shortage of information out there. There's information everywhere. In fact, it's daunting. It's like drinking water from a fire hose, and you're thinking, I don't know what to believe. I don't know what's out there, what's true, what's not true, who to believe, who not to believe. And actually, it's so much information, it's so hard to process. But the important thing to realize is, although there's information out there, there's no transformation. There's so much information. We have things you can Google, you can YouTube, you can look up anywhere. There's no shortage of gyms, yet we still have so many of our population that is sick and struggling with health issues with no answers in sight. And once again, like I said, there's information, but no transformation. And guys, it's all about transformation. And that's what we'd like to do for you, is to help you transform your body, to help you live the life that God created you to be. So many of you have a sole purpose that you know you're not fulfilling because you don't feel well, or your head hurts, or your body aches, or you just don't have enough energy to take on the day. Well, guys, what we're offering you is opportunity to get some help. Don't try to figure this out on your own. There's so much information. It's so hard to figure it all out on your own. Well, you don't have to. If you want more information about how we can help you, just click the link down below. I put a link in the description box that'll take you to a webinar. You can watch the webinar, and if it makes sense to you, if it resonates with you, if it vibes with you, and if you really feel it's in your heart to look into it further, at the end of the webinar, it gives you an option to schedule a call with me. We'll get on a call, we'll laugh, we'll cry, we'll find out what's working and not working in your health. We'll find out what your health goals are. Really, where do you want to go with your health if you can have optimal health? And if I can help you achieve that, I'll show you what that looks like. If not, that's okay too. I'll do the best I can to steer you in the right direction as to what serves you the best. But it all starts with you raising your hand, clicking the link and going to the webinar, and then scheduling a call. From there, like I said, we'll figure out if we can help you. If not, my goal is to give you clarity, but more importantly, to give you the next action steps that you need to be taking to regain your health. So guys, I look forward to speaking with you. I love and appreciate you, and I hope to speak to you soon. Bye-bye.